Nicola Katic, welcome. Welcome Turkey again.
Thank you so much, and I'm so appreciated. I'm here. Thank you for the invitation. Yeah.
Is proper surgical practice simply defined as intervening with a scalpel in every operation? Or does it encompass broader principles?
Well, just being able to cut, everybody can do that. This is not the surgeon's job. You need to make decisions. You need to have the patient, from the first to the last, just to have it, stabilized or whatever you need to do. You need to follow the process. It is not only cutting. Cutting. There is a saying that a good surgeon can cut. A better one knows when to cut, and the best one knows when not to cut. Sometimes you don't use the scalpel. Sometimes you need to treat the patient in the other manner. So just like, cutting is not always surgery. Surgery is more than cutting. That's my answer to that.
It's perfect answer. What are the most common operational mistakes observed in cases involving bleeding disorders in cats and dogs?
Well, first we need to define, just like these are different, patients, cats and dogs. Like we talked about the hemoabdomen today, the dogs in 50% of the cases will have a bleeding from a tumor. Cats will have more other diseases, on the list than just the tumor. Tumor is not the first one. It is coagulopathies or it is trauma. So just like this is the first difference. And secondly, the mistakes that we make, if you master anatomy, if you know where the vessels are, then you will know how to stop the bleeding. So this is, I think if a surgeon needs to take care of a bleeding, if you are in the OR, you need to master anatomy. Anatomy is the basis for the surgery.
Yes. This question very important for me. One of the topics you frequently emphasize is this green dye for surgical increasing marketing. Why is this practice particularly important to you?
Because it is just a new stuff. It is something that gives you a chance during the surgery, in the real time, to recognize the structures that you're dealing with. You see much better the gallbladder, you see much better the tumors, you can see much better the lymphatics, the sentinel lymph nodes, and it gives you information in real time about the processes you are dealing with as a surgeon. So this is a beautiful use of this ICG and near infrared surgery. Excellent stuff. It's something that the future will prove as a good opportunity for all of us.
Last question, TuVECCA Congress. Yes, could you please share your overall impressions of the TuVECCA Congress?
So this is my second time in Turkiye at TuVECCA, and I'm very glad that I'm here. The reason is it is a great opportunity to get in touch with people that are so motivated. Just 1,700 people coming for emergency and critical care and talking about other topics as well. This is beautiful stuff, and this engagement of the people and engagement of the board. And on the other side, you have a great content, you have a great social program around it, and social engagement in other areas. Like in this year, we are protecting the others that are unprotected. So and then supporting like charity run, just like for the forest. And so the acute social problems are also treated. It's not only veterinary medicine; it's more than that. And this is a great concept. I wish the whole team and everyone here just all the best for the future. I'm absolutely sure the future is bright for all of you. Thank you so much.
Thank you. Nicola Katic, thank you for coming. Thank you for answers.
I'm glad to come again. Thank you guys. Bye-bye. Goodbye.
Thank you very much.
Thank you so much.
Thank you.
Thank you.
Thank you.